Hey, welcome everyone. Welcome. We're glad you're here. We're just going to get started in a minute. In the meantime, I'm going to review a few items. Just want to remind everyone of our commitment to maintaining a safe and accountable space. If you experience issues and need assistance, please reach out to me by sending me a direct message found at the top right corner of your screen. To walk you through the tools in this session, I want to draw your attention to the vertical bar feature that has several icons to the right of your screen. If you have the event feed open, you're not going to be able to see those icons, so just click the little X in the upper right-hand corner so that you can see them. Once you've closed that event feed, you can see the vertical bar. It has several icons. There's a couple of speech bubbles. That's the chat box for the session. Then there's another speech bubble below that has a Q and an A in it. That's the Q&A section. So that's where I would like you to put questions for the presenters. If you see a question that you like, that you really want to make sure gets asked, you can vote for that question, and we'll make sure that's one of the questions we ask the presenters. There's also an icon that shows the participants in the session. That's the little group of people. And finally, you'll see two papers, one stacked on top of another. Those are the resources for the session. So that's the slide deck, and then any other resources our speakers have decided to share. In order for us to keep up with questions, we ask that you please only use the Q&A icon to share your questions. And again, feel free to vote for questions that you like. And that's that third icon from the top. If at any time during the session you need to step away, take a break, debrief, or decompress, please feel free to do so. We have a wellness room and it's open. You may enter the wellness room by clicking on the wellness room button on the top left side of the event navigation bar. And one of our team members will meet you there. Okay. It's now my pleasure to introduce to you the speakers for our sessions so that we can get started. First, we have Dr. Terry Deal, PhD. She's a Deputy Managing Director at the National Center for State Courts. Her work focuses on child, youth, and family justice with a specific emphasis on implementing and evaluating court practices, continuous quality improvement, and systems improvement efforts. We also have Judge Marcus Vanover, who is the family court judge for the 28th Judicial Circuit, Division 3, serving Lincoln, Pulaski, and Rockcastle counties, Kentucky since 2013. Judge Vanover serves on the Kentucky Judicial Commission for Mental Health, where he leads the Dependency, Neglect, and Abuse Work Group and the Upstream Initiative in conjunction with the National Center for State Courts. He serves as the family judge co-chair of the Kentucky Circuit Judges Association Education Committee. Mary Carpenter is an executive advisor with the Department for Community-Based Services, DCBS. Her focus is expansion of primary and secondary prevention efforts to promote well-being in families and communities, which includes an emphasis on engagement and lifting the voices of parents, youth, and other partners who have been or are involved in the child welfare system. And finally, we have Valerie Frost, who is a Strategic Initiatives Associate at Kentucky Youth Advocates. Using her experience as both a teacher and parent leader, she's passionate about advocating for children, families, and communities, particularly in the areas of childcare, education, special needs, safety net programs, and child welfare services. So welcome again to our speakers, and the stage is yours.
Thank you so much, and thank you all for being here today. We're so excited to share with you the exciting work that Kentucky is doing to go upstream and strengthen communities so that children and families are able to receive support and services that they need without court involvement. I'm Terry Deal from National Center for State Courts. If you're not familiar, NCSC is an organization that helps all types of courts do a better job administering justice. I work primarily in children and family courts and have had the privilege of facilitating upstream mapping workshops now in 6 states. I'm actually coming to you today from Rolla, Missouri, where we are in the middle of an upstream mapping workshop. Today, I'm going to give you a high-level overview of Upstream and then pass it to Judge Vanover and Mary and Valerie, who are going to talk specifically about efforts in Kentucky. We want to start though by hearing from you. So we are curious if you could tell us who is in the room. So if you could put your role here, I know we probably have some people from behavioral health. I'm really curious if we have anyone from the juvenile court or from the child welfare agency. So if you could join slido.com or you can use that QR code to get to this poll and type in 3647109. That will give us an idea of who is here in the room. It looks like we have someone from CASA here. It's great. I'll give just a couple seconds. I see a couple people are still typing. We have a child welfare from a professional from Wisconsin, and a couple more, a court liaison. Okay, it looks like there's a couple people from child welfare professionals from Wisconsin here. Family and Children First Council. I see someone from Kentucky. That's wonderful. A court liaison. Someone from Maryland. So I see a lot of child welfare folks. Happy to see from court connections, and certainly a lot of partners that courts and behavioral health and family services works with. And I see lots of states too. I see people from Florida, Maryland, Wisconsin. It's wonderful to see such a range of roles. I see a defender here. That's awesome. A public defender, some therapeutic folks, a psychiatrist in DC. So I see, and the word cloud services is growing bigger and bigger. And so that means a lot of people are using that word services within their responses to this poll, which is wonderful because one of the primary goals of Upstream is to identify what kind of services, resources, and supports are available for youth and families in the community, and what opportunities communities have to improve access to those services. So I see just two more people. I'll let them finish typing, but I'm happy to see such a wide range of professionals here with us today, and a wide range of fields with us today too. So there's one more person. Oh, and I see Prevent Child Abuse Indiana is here. Indiana is one of the first states where we piloted Upstream. So thank you for joining us. I mentioned there's such a wide variety of people from different fields here. And that's one of the key reasons that we do upstream mapping, because the families that we work with in communities work with and interact with so many different services and systems every day. And so one of our goals with Upstream is to get those separate entities to communicate, collaborate, and coordinate their services, resources, and supports. So Upstream mapping workshops are really an opportunity for community partners to talk about what they're doing, what they could be doing better, and how they can make better use of the resources that they have. Upstream is built on that principle that it's all of our responsibilities to support health or to support safe and healthy children, families, and communities. We know that the courts can't support communities on their own, schools can't, agencies can't, behavioral health can't. We all need to work together. And so these upstream mapping workshops are that opportunity to have these discussions that we often don't get to have. Upstream is a judicially led, community-based effort. Our goal really is prevention, so preventing maltreatment, preventing system involvement, and when there is system involvement, ensuring that partners are working together to coordinate efforts and best support those families. Again, ultimately, we're looking for how we can build strong, safe, and healthy communities. So we are judicially led, and I'm thankful that Judge Vanover is here with us today. We think that that's such a critical component of Upstream, because when families do get to the courts, they have likely been involved in different systems or with different interventions many times. And so it's usually not the first time that they have been struggling. And so the court, again, can't solve all these social issues on their own. They need to, have a unique position to see what happens when our communities don't have the infrastructure that they need to support healthy and safe families. And so we really feel like the role of the judge is convener and also important voice, a community member at the table. So, um, we often talk about judges as conveners in my field, but again, we find that judges have this important role here as convener and also as a participant in our mapping workshops. So the Upstream mapping workshop is actually an adaptation of sequential intercept mapping. So if you've heard of sequential intercept mapping, that is a framework that's been around for a while that identifies points of prevention and intervention in the criminal justice system for individuals that have behavioral health needs. Upstream adapts that framework so that it fits to child welfare and juvenile justice. And what instead of looking just at one individual's experience through the system, we're looking at an entire family. We don't come into a community with a list of what services, resources, and supports they should have. Instead, our jobs in the mapping workshop is to facilitate the communities to have that discussion themselves. So we talk through at each mapping workshop things like social determinants of health, and we talk through what is access to healthcare. What does that look like for all families in the community? What is access to quality education? Are there jobs? Are there job training centers? What does the community look like in terms of um, social determinants of health, which are things that have been associated with increased outcomes and better health outcomes and better life outcomes for families. So we're really focused first on that entire community and what resources, services, supports are there, and also what barriers families in the community experience as they try to access those resources. And then we talk more specifically about families who are experiencing risk factors. And these would be risk factors for maltreatment or risk factors for delinquency. We talk about individual risk factors, but also family and community risk factors. And then what do we currently have in the community that mitigates those risk factors? What do we need? And how can we work better with what we have to help offset some of the risk factors that we know can lead to negative outcomes for families. So that mapping workshop takes about a day and a half. And at the conclusion of that mapping workshop, the community has an action plan that they're able to implement to increase the safety and health of their community. We have 3 phases in Upstream, a statewide leadership planning phase, which we will plan with the state about how that rolls out. We also train facilitators in each of the communities where we work so that states have the capacity to do mapping workshops on their own. And then finally, we have the mapping workshop, which I've been talking about, and that action planning implementation that goes along with that. I'm going to now pass it to Judge Vanover to talk more specifically about the judge's role in Upstream and Kentucky. So thank you.
So we all know that mental health has many different faceted impacts in our court system. We have criminal courts where we have competency issues and child welfare, where mental health of both the children and the parents or caregivers can often be a factor in whether the child is abused or neglected. We have guardianship procedures for adults who have difficulties making their own decisions. We have involuntary hospitalization for people for mental health or behavioral health issues. Additionally, with substance misuse, alcohol dependencies, and other things that impact our mental health, impact our court system and justice involved individuals. If we can go to the next slide. One of the ways that Kentucky is working on addressing mental health in in our courts is that we've established the Kentucky Judicial Commission on Mental Health, which is headed by our Deputy Chief Justice, Deborah Lambert. If we can go to the next slide. Some of the efforts that we took before establishing the Judicial Commission, our courts began to take a look at kind of changing the way we're dealing with individuals involved with the court system and shifting our approach to a recovery-oriented system of care. We wanted to look at a system-wide approach to improve the outcomes for all the people that are involved with our court system. In 2021, the court here in Kentucky, we assessed our readiness to move toward our recovery-oriented system. And then in 2022, we received recommendations to establish that group that we're going to take a look at in establishing our commission. If we'll go to the next slide. So in August of 22, then Chief Justice John Minton established our Judicial Commission by administrative order, appointing, I think we have approximately 75 individuals. All of these individuals come from various aspects of court involvement and community involvement. We have people from all three branches of government. We have executive branch members. We have several legislators on our commission, and we also have several judges on our commission. But in addition to our governmental agencies, we have our community partners who are also working with people and experiencing mental health issues and substance misuse or intellectual disabilities. Those community partners that are also part of the 75 members of our commission. If we'll go to the next slide. As I said, we have 75 members appointed by Supreme Court Order 2022-53. And we have a strategic plan that we implemented early on once our commission began. Next slide. Our structure is that we came up with three subcommittees on the commission. One is our criminal justice committee, and the criminal justice committee has work groups that focus on juvenile justice, competency restoration, pre-arrest and diversion. We also have a civil and family justice committee. Under that, we have work groups that are working regarding dealing with mental health issues and domestic violence, with our guardianship and commitment individuals, and that I think has actually divided into two work groups now that can focus more on the guardianship, and then one that focuses on the commitment as that's emerged. And then we have our dependency, neglect, and abuse work group, and our Upstream project has stemmed out of the work from the dependency, neglect, and abuse work group. Then we have more of a general overview in our treatment and access committees. We deal with court responses to mental health, strengthening community responses, and intellectual and developmental disabilities. And we'll go to the next slide. This is just a brief overview of how our subcommittees are laid out in the individual work groups and the names of the leads of those work groups on there. If we'll go to the next slide. One of the things that we've tried to rely upon in our Judicial Commission is the recommendations from state courts leading change. This publication was provided from the Conference of Chief Justices and Conference of State Court Administrators, who created a national judicial task force that reviews how mental health and mental health care systems impact our nation's courts. This task force published a report in October of 2022, and there were 11 recommendations that came out of that publication that we've tried to respond to with our commission. this report was provided to us at our first meeting and has been key in how we've been looking at making changes within our court system. I'll talk about some of looks like we have 5 here on the first slide. One of the first things that the first recommendation was state courts and trial courts leading change. And the recommendation is that we have all 3 branches try to work together along with multidisciplinary partners that can, take a look at this on a system-wide basis. They recommended that anything that we try prioritize deflection and diversion to treatment rather than into the court system. The goal of that is to try to keep as many people out of the justice system as we could and get that treatment without court involvement. But then if they were already in the court system, to try to look at these things to make sure that we were addressing the mental health needs at the earliest point possible that we can. It recommended that our courts reform the competency to stand trial, limit the competency process, and improve programs for restoration of improve restoration of competency. Our commission actually proposed legislation which just passed, I believe, last month, which is going to kind of revise our competency process. So we are making progress with that. Another recommendation was the court and community collaboration to focus on person-centered justice. We wanted to have collaborative courts that have new ways for case management that deal with how we court-involved individuals with behavioral health issues, that we focus on the person rather than the system. The next recommendation was changing the law and process for civil commitment with more of a focus on outpatient options. Next slide. And this next recommendation, 6, was for a focus on children, youth, and families, so that we can have a continuum of care for better outcomes for our families and children. One of the things we looked at was diverting youth with mental health outcomes, mental health needs, and to make sure we're working on trauma responsiveness for our families. And this is where our work with the National Center and on the Upstream project that we're talking about today came into play under this particular factor. We also wanted to make sure that we're focusing on training and education for our judges and our court professionals, and that we make sure that everyone has proper training on trauma-informed care options. We want to address behavioral health and equity to make sure that we have inclusion for all individuals in dealing with all programs and all processes through our court system. Voices of peers and individuals with lived experience and families, dealing with our peers and peer support and folks with lived experiences in making our recommendations and working with them as part of our commission has been key. And then finally, the last 2 is working on the well-being of judges and court personnel to address any secondary trauma that may be associated with hearing these types of cases. And making sure that they're looking out for their mental health and working with our individuals. And then finally, asking the right questions, making sure that we're keeping our data appropriately, that we're sharing our information across systems, and then that we're analyzing that data to make sure we know what is working and what needs that we need to do. Next slide. So some of our short-term outcomes that we've had so far. We believe that we're having more meaningful collaboration between the judiciary and our partners. We are increasing educational and professional development, in particular the dependency, neglect and abuse work group that we're working on. One of the things that we're trying to do there is we're working on more training that deals with our attorneys and our workers, our social workers, and other community partners, and to make sure that we're all on the same page as far as development and training. We're also working on programs for training our court-appointed attorneys and guardians ad litem, to making sure that they're up to date on child development issues, mental health issues, but also the legal standards that are associated with representing people in our child welfare system. We're working on more efficiently using the resources that we have. That is a huge part of our resource mapping, and identifying the resources that we do have, and trying to work on increasing capacity for the programs that we do have, and early identification and increased diversion opportunities. Next slide. Long-term outcomes that we're hoping to have is we're working on increasing our early identification and capacity to serve justice-involved individuals. We want to make sure that we're really focusing on our diversion programming, and that we know what is working, and that we're trying to improve the programs that we do have. More accessible funding for communities to serve those in need. That's especially true here in Kentucky, where we have a few more urban centers, but the majority of our state is heavily rural, and we're trying to make sure that we are able to spread the funding to be able to suit folks who have transportation limitations and things like that, are able to serve all of our communities equally. Successful integration and dedicated courts, and we're one of the processes with Upstream and our resource mapping is that we're hoping to have a statewide rollout on our resource mapping, and have action plans for each community that we serve in order to make changes and make sure that we're utilizing these resources that we have. And then we'll be able to also identify in neighboring communities other resources that can be utilized in maybe underserved areas. Next slide. Some of our current initiatives with the Judicial Commission have been, we're continuing the statewide efforts. We've made legislative recommendations. We had several successes in the last session, which just ended in April, and we're getting ready to start working on our legislative recommendations for next year. Additionally, this year we have had several town hall meetings in various regions of the state. We've gotten a lot of feedback from community partners, but also from people that have been involved with the court system and needs that they have in order to get some feedback to make changes in our programs. We've created local task forces. We are working on the sequential intercept mapping for our criminal justice system. We've also done mapping for our juvenile justice system and the upstream mapping for this. So when we first started our commission, I remember sitting in our meetings thinking, we have lots of goals to reform our mental health system and how our courts involve mental health individuals across that. And I remember thinking that the process was very overwhelming. And then I remember, in order to walk that 10 miles, it begins with the first step and taking it step by step. So, you can't address everything at one time. You've got to, start the journey and, deal with the issues as they come. But one of the things when it was presented to us as Upstream, it was explained is, we're spending a lot of resources late in the game. Folks like my co-presenter here, Mary and Valerie, working with our child protective services in the past, and with me in the court system, we've been, we're walking by the river and we're seeing people float down, and we're jumping in and trying to save them. And, as more people become involved, we're expending more of our time and efforts in trying to rescue them. And, it wears on the system, and it wears out the folks that are trying to deal with the people that are in the courts and doing that. So luckily we have people like Terry come along, and she has seen our efforts and gone on up to figure out why the folks are following in the stream. And she found that the road was washed out. So, we're not going to be able to stop the tide of people that were trying to rescue in the court system until we addressed the problem of fixing the road upstream and trying to catch those people before they fall in the water. So that's really kind of the goal of how Upstream was it will work, trying to put our resources before people get in trouble rather than trying to rescue them when they're downstream and in danger of drowning. And that's where the name Upstream came from, and where we're focusing our efforts with our mapping. So we have had statewide mapping. If we can go to the next slide. We have had statewide mapping events, as I said, in criminal justice with our sequential intercept mapping. We have had our statewide mapping services with our juvenile justice plan and with Upstream for our child welfare plan. And now our work is to put those into place in our individual systems. And I'm glad to be able to say today that my jurisdiction here in Pulaski and Rockcastle counties will be the first of the local mapping events that we're going to do with the National Center starting next month. We have all of our judges are sponsoring this event and on board with making sure that this happens, which satisfies our courts as conveners and leaders. So that we're doing our mapping not only for Upstream, but we're doing our local mapping for juvenile justice and criminal justice at the same time. We have people involved from all aspects, all of our community partners with education, local governments, providers, our jails. We're working on peer support individuals and things of that nature to make sure that we have all different perspectives to bring forth on this project. The next slide, and this is the last one that I will have. As you can see, this is just for a comparison of how we have people with court involvement. From the slide, you'll see contributing risk factors and co-occurring factors, that people with DCBS history and financial issues, but we have a huge, on the third column, a huge involvement of people with mental health issues, and then co-occurring issues with that play a significant role in over half of our cases. So mental health and behavioral health is a huge part of what we deal with. Substance abuse there in the last column also contributes. So being able to address these things and making sure that we're employing our resources and addressing, in the best way possible, finding out what we have, what we need, and what is working is going to have a great impact because of the large number of cases and large percentage of involvement in our cases that deal with mental health issues, substance abuse issues, and things of that nature. So that is all I have, and I'll turn it over to our next presenter.
Thank you. Hello, I'm Mary Carpenter. I am with the Department for Community-Based Services, and myself and Valerie are going to talk a little bit about how the work of the courts really ties in with the work that we've been doing with DCBS and the community, and really moving upstream. And when the administrative office of the courts said that they wanted to do this work with Upstream, it really tied in with what we were doing at DCBS and had been doing. Kentucky was an early implementer of Family First back in 2019. And when we did that, we quickly learned that we didn't go far enough upstream. And so we've been doing some different things, and we're going to talk a little bit about that. So next slide. So DCBS is really more things than just child welfare. So under DCBS, we have protection and permanency, so child protective services, adult protection, but we also have family support, which is our TANF, SNAP, but we also have prevention. We have childcare that falls within that, and we've really been working at DCBS within those divisions to help our staff really see their role and that they play in prevention and preventing families from coming to the attention of the Child Welfare Agency. And I'm going to pass it to Valerie.
Okay. We can go to the next slide. All right. Hello, everyone. Good morning. Once again, I'm Valerie Frost. I am a Strategic Initiatives Associate with Kentucky Youth Advocates. We are a nonpartisan, independent voice for kids, and we work to address systemic issues such as child welfare, court involvement, and prevention. And we can go to the next slide. So the question is, why are all of us here? We have courts, we have the Child Welfare Agency, and myself. So we are all three of the statewide partners on the Kentucky site team for the larger national Thriving Families, Safer Children movement. And Thriving Families, Safer Children believes in reducing unnecessary family separation through strengthening communities to be proactive. So kind of going back to that image of the river and people are being rescued and that the judge had referenced. So being proactive through prevention efforts, community-based support, and by partnering with community, including those who are directly impacted by systems. And that's what brings us all here today, because this is all part of several initiatives for supporting families and hopefully reducing that data that shows that people are involved with either Child Welfare Agency and or the courts. All right, we can go to the next slide.
So when we think about like why we're doing Thriving Families, Safer Children, why we're moving upstream, when we're meeting with community partners, when we're talking to communities, we use our CPS intake data to really show what those missed opportunities are. We get over 100,000, you can see here 123,000 intakes this past year. And of those, that's the total intakes that come into our Child Protective Services line. 50,000 of those are actually screened in, but of those, only 11,000, a little over 11,000 are actually substantiated, meaning they actually are abuse or neglect. And so we're thinking about those missed opportunities. So families that where we know there might have been a concern, someone had concerns for those family, but they're not receiving services, they're not receiving supports, resources. And so thinking about the opportunity for community to really step in and provide supports for those families. And so something in the system really isn't working there, and thinking about opportunities for support for those families earlier. Really trying to think about the trauma that those families experience just from the knock on the door, when even if it is going to be unsubstantiated. Next slide. So this is really our sort of our blueprint for prevention. So we're really trying to move towards thinking more towards a 21st century DCBS. So we have what's called we have an 18-month strategic plan that's sort of our overarching plan, and then Thriving Families, Safer Children sits under that. And so we have these structures in place that are really our guide towards prevention. A big part of that is lifting the voice of lived experience, like Judge Vanover mentioned that the courts are doing. We have Trusted Advisors Council that really helps to guide the plan. That's a council that's made up of lived experts and is a really important part of guiding the work that we're doing. A big part of this is really decreasing barriers for families, increasing access to services. We are really looking at implementing programming around how they're receiving those services. We're implementing a community response, differential response, across the continuum, so alternative response, and really trying to do that in partnership with those lived experts. So this is sort of our structure for that. Next slide. So in order to do that, we really have to have partners at the table. DCBS cannot do this alone. That involves all of our partners. DCBS is not the child welfare agency. We are the child welfare agency. But we're not the child. We can't do this alone. So we really have to have all partners at the table, really helping us, and we depend on those partnerships to help move the work and really tell us what the needs of the families are, really be trusted partners to help move the work. And we're really trying to look at different partners, not just those same governmental partners that we've depended on historically, but really trying to think differently about the types of partners we're engaging, getting into communities, those partners that families trust, and really thinking about, the partners that families go to when they're in need. Next slide. So in 2022, we did a reorganization to actually create a division of prevention and community well-being, because we wanted prevention to actually be embedded in the work that we do. And so this is sort of a visual framework for what that looks like in our department. Thriving Families, Safer Children sits under that. Our statewide prevention collaborative sits under that. We have regional collaboratives that sit under that, but we didn't want prevention to go away with an administrative change, and with the change of a governor, with the change of a commissioner. And so that was really important to us. Within that, we have primary prevention branch, a secondary prevention branch, and our Family First work actually sits under that as well. And so that's really part of that. And then Thriving Families, Safer Children, all of that fits within that framework. Next slide.
All right, back to me, everyone. So DCBS, the Child Welfare Agency here in Kentucky, they did begin an initiative very similar to the Upstream model about 2 years ago by modeling after visioning sessions that another Thriving Families, Safer Children site team had started. And so these visioning sessions gathered those living, working, and serving in all of the 9 child welfare regions in the Commonwealth, and created an action plan for prevention. So these regions are now in the middle of reconvening through revisioning sessions, because they want to re-envision prevention, and reassess those action plans. And so I bring all of that up to say that our hope is, as the Child Welfare Agency, as the courts are now rolling out Upstream, that we are all in alignment and working together so we can partner for stronger communities. Because like Mary mentioned, Child Welfare Agency, they're not the only ones that are part of the child welfare system, and we should all work together, especially because families and children deserve everyone at the table. So we can go to the next slide. And this is an example of one of the action plans. I don't know if you can read it, but mainly it is addressing the reasons why the families are falling into the stream, of while they're in the river and needing to be rescued, and really just taking that data that shows what is the reason for involvement, what are those co-occurring needs, and backing up and saying, how can we just support them in the community? How can we collaborate a little bit better, not work in silos as much? How can we get these families connected? And how can we support them before it really does escalate into a need for intervention? Because when there's a crisis, when something occurs, at that point, you do need to get involved for the safety of the child. So here's an example of one of the plans, and we have different strategies, objectives, and timelines, and also an imperative for communities. Whether someone has a family or not, everyone has a role to play in keeping children safe and keeping families strong. Whether you're a business owner, there's families coming in, you're interacting with people every day. It could be the schools. Obviously, that's where children are going. It's just every single person really that lives and works can look out for someone, be a neighbor, and be a helping hand and connect those that they see. So we can go to the next slide. So bringing back again, and this is probably what I'm the most proud of, is really connecting with those who are directly impacted by the systems and those that are the foundation of communities, which are the families that are being served. And so key aspect of all of this prevention work, these initiatives, is involving those that are on the other side and actually bringing them alongside instead of being on the other side. And so that is those that have lived experience, those who are directly impacted and have that firsthand experience of knowing what it'll take for all of these efforts to be successful and helpful. So engaging lived experience has a profound impact on community and programs and policy strengthening and improvement, because who knows better than what families need to be strong and thrive than the families themselves. And so they have the closest proximity to all of these different needs that we are talking about. And so there's a lot of value in the court and community relationships to support positive outcomes for youth and family and community, but also, like we see now modeled here on this call, we have court and child welfare agency and community all coming together. So our greater hope through all of this is to continue efforts with the regions, with the whole Commonwealth, to align upstream, stay connected, and just have a similar vision in mind so there are no gaps for families. And so we know the influence of lived experience. Really, it just shines a light on maybe some of the blind spots that might exist for professionals and systems. And it just leaves those people feeling empowered and heard and hopeful. And I think that is what is key and the most important. And so we just hope that these continued collaborations across the board and partnerships leave everyone feeling hopeful and not kind of in that rescue and being rescued mindset.
Yeah, and I'll just add that has really, I think that engaging with lived experts really, it will be the thing that shifts our system, and you have to really be open to feedback. And we're definitely not where we want to be in Kentucky with that, but I think we're headed in the right direction, and that will be what shifts our culture, with our and so I am really proud of where we're at, and we've really come a long way with that. So I appreciate that. So thank you. And I think I don't know if there's any questions in the chat, but this is our contact information here, and you can scan those if you need resources. And thank you all so much for joining us today.
Hi, yes, thank you so much to all of our speakers. There were a couple of questions that I'll bring up because we have some time for questions. The first one, I know Judge Vanover answered in the chat, but I'll ask it out loud too so that everyone can hear the answer, was from Shannon Olson. She asked, what have you found to be one of the barriers in getting your mapping completed, Judge Vanover?
So as I said in the response, the biggest challenge was getting it set up and finding the time to get everyone at the table. It seems like when we started planning, well, we need this resource, then we need this resource, and we need this resource, and eventually we came up with close to 150 different agencies and partners and things like that to bring up, and trying to plan for having that number of people at the table. It just took some time, but we had tremendous response and a lot of people willing to participate and willing to come out to see what we were doing and be part of that and to work with us and provide input and give us suggestions. And so we had tremendous response so far. Now that we're getting ready to start rolling out into the local communities, it's kind of just identifying our resources and the people that we need to bring to the table in the local communities. Identifying our local facilitators that are going to help with these mappings. And so we're thinking that now that we have done the statewide mappings, we have the reports and recommendations that way, and we kind of know what groups we're looking for, that we can start moving a lot faster with getting this rolled out on our local levels across the state. So we're excited about getting our local planning moving. I don't know if any of the other speakers have any input in or thoughts on that.
There were a couple other questions too, I think for Mary and Valerie. One of them says, I'm not familiar with how family court judges are elected in Kentucky, but if through elections, how are you able to onboard new judges to this approach?
So, our judges are elected through, as elected on a nonpartisan basis. Initially when they come on, we have orientation and training with everyone. Our last election 2 years ago, we had approximately 50 new judges across the state on the family court basis and spent a week training them on everything that they needed to know. And but we also have regular contact. We have a mentoring program with them to help share this information as these programs roll out.
And then there was the last question here asks for engaging parents with lived experience. Do you provide any stipends or cost reimbursements like transportation or childcare to individuals participating in the meetings? Also, can you comment on using birth parent over parent for adoptions?
Yes. So we do provide stipends, and I don't know if we actually have a contract. DCBS has a contract with Kentucky Youth Advocates for the trusted advisors and for Kentucky Seat, and to reimburse them for their time to participate in meetings. And a lot of our trusted advisors and parents on the council participate in conferences. They participate in co-designing with alternative response. They do a lot of different things. So, and they are reimbursed for their time. And Valerie can probably speak in more detail to some of that because she's really, really involved with that. As far as the use of birth parent over parent, I actually, Valerie and I talked about this early on. I actually asked Valerie about the use of birth parent versus parent specifically. We had some conversations about that with our Parent Advisory Council. Specifically, I'll speak for myself. I did not want to use birth parent. I thought and so Valerie spoke with them about that, and the parents wanted to continue to use the term birth parent. So we stayed with that because that's what they wanted, and so that was their request, and so that's why we use that terminology. I don't know, Valerie, if you want to add anything.
Yeah, I'm happy to speak to both. So yes, once again, I'm with Kentucky Youth Advocates. So we are a nonprofit. And so with that contract, it just allows us a little more flexibility than the state process for compensating those with lived experience. I'm very passionate about this area. I am a parent that has lived experience with the child welfare system. And so kind of going back to what, when we looked at the blueprint for prevention from DCBS, and Mary was talking about their intention to reduce barriers and increase access. And I feel the same way in partnering on this work. I know with the system, there can be barriers, or maybe the old way, and hopefully we're all shifting away from that. But in engaging those that have lived experience, I do not want to be a barrier or create any more barriers, and I want to increase access. And so we know for people who are directly impacted to show up to the table, even if they are at the table, does not mean that they have the full opportunity to show up as their full selves. And so when we're talking about reimbursements, accommodations, it is really important to consider all of those extra things that someone needs so that they can show up and have as much equity to be there as anyone else. And so everyone does get paid by the hour. They get paid for their time, their engagement, but also reducing as many barriers as possible. So we do have a childcare stipend. We do mileage reimbursement for transportation, or we make transportation arrangements if possible. Everybody has support with clothing, what to wear to these meetings. It's like Mary mentioned, some of them are having speaking engagements. They're going to conferences. They're going to meetings with the court, with the child welfare agency. And so as many of those things as possible that we can accommodate so they can really, truly show up and feel like an equal partner in these conversations is important. And so as far as birth parent, yes, this has been a conversation and has been ongoing. I will say, so I do facilitate KYC, which is our statewide birth parent council, and that is parents all across Kentucky that have had child welfare involvement, whether it is prevention services. So it might not even have been an actual investigation or case, but maybe just like family preservation prior to involvement, all the way through. We have some parents that have not been reunified yet. There's a lot of overlap in role. So just because someone is a parent does not mean that they're showing up just as a parent. We have parents that are also relative caregivers. We have parents that were in the foster care system as a child and then had child welfare involvement as a parent, as an adult. So there's a lot of overlap with just one person. I think the sentiment of birth parent is really leaning toward family of origin more so than anything. So if someone adopts a child and they are the primary caregiver, the origin home, that's would be a similar concept. I think we just wanted to stay away from a child that was put in out of home care and then that person now becomes the parent, because that's a little bit different of a dynamic. But we have step parents on the council. We do have, like I said, we have some that are also relative providers. We have some that became foster parents that had their own children. So it is really fluid. As far as the Trusted Advisor Council that Mary mentioned, that is a mixed stakeholder group. So it is anyone that has child welfare involvement, whether it is birth parents, foster parents, relative caregivers, or former foster youth. And once again, there are many people on that council that fulfill multiple roles. We have relative caregivers, fictive, and kinship, who also have their own children, who also did foster care through kinship. There's just a lot of overlap. So really just supporting those that are directly impacted and those who want to advocate and partner with the system so that we can all work together is really what's mainly important.
Thank you so much to all of our speakers. We're at the end of our time, but I just want to say thank you for sharing your time, experience, and expertise with us. And for those of you who attended, thank you so much for being here. The next session starts in 30 minutes. We're going to hear from the keynote speaker, Dr. Tanisha Foster Freeman, who will be exploring the individual, interpersonal, and organizational factors contributing to mental health disparities among Black and Brown youth and young adults. Discover actionable steps to foster caring and equitable systems in collaboration with our communities, aiming to eliminate disparities and create meaningful change. Also, please complete the summit survey on the reception page at the end of the day. We really appreciate your feedback. And as a reminder, you must complete the survey to request the continuing education hours. So thank you all so much for being here.